really even need to know, oh, this is a stroke. You don't even have to really know too much details in regards to what part of the brain or what if it's a ischemic stroke or it's a aneurysm of some sort. You follow the system itself, with diagnostic tools, and it's going to lead you to what areas on the scalp that you need to actually utilize. And I think that's important. A lot of us are often really focusing on the condition rather than just using the system of using the palms of the hand to see where the circulation's going. Is the circulation better on the left or the right, by looking at the color of the palm, and then going to Hegu area and palpating, then going to the elbow and feeling at the elbow crease and seeing what points are sensitive and not so sensitive. And then, okay, yeah, great, that's fantastic. We'll go to the bicep and see the brain points, see on the bicep what points on the brain are actually sensitive. And then go into the neck and feeling for sensitivity on the neck to do with the internal organs. Now, if you just follow those processes and feel for the palpation and sensitivity in these areas, it doesn't matter what condition you've got. If you follow that system and you apply the needles, it doesn't matter what issue you've got, you're going to get some sort of result. And that's important for us to know. It's important to know the conditions, but a lot of the times, especially when you're first starting off as an acupuncturist, you might not know, you might know what a stroke is, but what type of stroke? How big was the stroke? And you've got all these ladder names that you get hit out with, and you go, I don't know anything about this. But if you actually just follow the system of Yamamoto and just do the palpations and follow it, you're going to get some sort of result. And from there, you can just build and scaffold from those diagnostic tools.
So what is the difference? Like, you've learned New Scalp Acupuncture, I've learned gel style, and last year you came to Melbourne to learn from Tetsuharu and Sensei with YNSA. So from your own experience, like, what is the difference with Yamamoto and other style of scalp acupuncture?
So the first thing, it's got its own diagnostic process. Okay. When we look at gel scalp acupuncture, or we look at zoo scalp acupuncture, it doesn't have its own diagnostic tools. What we were just talking about, using the palm, using Hegu, using the wrist, using the bicep, using the neck for diagnostic tools. Okay. So that is an important part of Yamamoto, and no other scalp system that I've actually learned provides that type of diagnostic tools. So that's number one. Number two, once you become proficient with the diagnostic tools and sensory of being able to touch and feel these particular areas, you can implement these needles quite quickly. And you don't have to manipulate the needles. You don't have to do tonifying, reducing technique. You place that needle just underneath the skin. So that's important. So once you get quicker at your diagnostic tools, it's actually quite quick to implement. The other thing is, I'm only going to speak for myself here. When I do scalp acupuncture, if someone comes in with back pain, I'll do sacral, I'll do lumbar, and I'll do the hip. And, if they've got sciatica, I'll do the leg. With Yamamoto, sometimes what I do is, when I do the diagnostic tools, after doing the diagnostic tools, I actually do D point, and I might do F point. Boom, 2 needles. It's like, whoa, what just happened? So I'm limiting the amount of needles I'm using. So that's one of the advantages of Yamamoto scalp acupuncture. No threading, no constant stimulation like what you see in gel scalp acupuncture. 120 times per minute, 200 times per minute.
200 times, not 120.
300. Oh, sorry.
Yeah.
But the manipulation, you've got to stay there and you've got to do the manipulation and you've got to do the tone with the gel. So you've got to manipulate those needles really quickly. And with Jew, again, you've got tonifying
Sedating.
and registedating methods and harmonizing methods that you can actually utilize. And that takes time in the room, right? But with Yamamoto, put the needle in, hasta la vista, next room. So you're able to see more clients. Okay. So if you've got a multiple practice where you've got more than one room happening, okay, as long as you become proficient with your diagnostic tools, needling, 2 or 3 needles. And if you're a practitioner that loves only using 2 or 3 needles, Yamamoto is a really good system to actually utilize. But they're the major benefits of Yamamoto Scalp Acupuncture. Not saying I don't use Zoo. I use Zoo all the time. I use Jiao as well. And sometimes you just combine the systems together to make it your own.
Yeah.
Yeah.
So what type of conditions do you, from your own experience, do you think YNSA is suitable for, and or specific symptoms that is your go-to method, acupuncture method, like spasticity, pain, nerve pain, or tinnitus, sinus, or what is your go-to, like YNSA, what do you use for?
Neuropathy. I love it for neuropathy. Sometimes I utilize other forms of scalp acupuncture and I get some good results with it. But sometimes, when it comes to pain and numbness going through to the fingers, and it's like, you do your distal needling and you try this, and then okay, I'm going to Yamamoto, and I just put one needle in. I go, my goodness, why didn't I just start off with that?
Wasted
But
so much
that's the
time.
nature. That's the nature. Yeah, you're using your experience and you go for what you think is best first, and then you go, okay, what else can I use? And sometimes I think when it comes to neuropathy, for me personally, using Yamamoto scalp acupuncture just underneath the skin is just fantastic. So I've been using Yamamoto for MS in the clinic, Parkinson's, throat cancer, chemo-induced neuropathy. I've been using Yamamoto for. They're some of the major areas and I've experienced using Yamamoto, and fantastic. Really happy with the results that I'm getting in clinic.
Yeah. So do you recommend YNSA to other acupuncturists?
Of course, you need to do this course. Why would you, as an acupuncturist, want to do this course? Don't have to use too many needles. If you're not very good at doing the pulse, looking at the tongue, okay, you've got your own diagnostic tools that you can utilize. It's 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 a system within itself, and you can use it as a standalone, or you can utilize it with other systems as well. Well, I do anyway in the clinic.
Yeah, okay, thanks. So Jeff, I'm going to start again with some of the question at the beginning because I forgot to press the recording the first few. No, that's why I will cut this part. But the thing is,
That's all right. That's all right. That's
I
right.
pressed recording 2-3 minutes in. So, okay, we start. And hi, Jeff. Thank you for coming tonight to join me to talk about YNSA.
Thank you for having me tonight. I really appreciate sharing some of my experience with YNSA. It's been almost, going on to a year since the seminar in 2023.
In Melbourne.
In Melbourne, Sustain Health.
Sustain Health Academy, yes. So what you have been applying YNSA in your clinic, are you able to tell us a little bit more for the last 12 months, after you learn YNSA, what is the biggest takeaway and what is the uniqueness of YNSA that you would like to say about?
The uniqueness of YNSA is it's got to be with the diagnostic tools that we utilize using the palm, see the color of the palm, if there's better circulation on one side compared to the other, using Hegu, okay, for sensitivity to choose which side you will end up needling, and then going to the elbow, and from the elbow you can tell a lot about what's happening musculoskeletal wise in the body, and then going to the bicep is basically the brain area, and manipulate, just touching those areas to see for sensitivity, and then go into the neck, and the neck's got to do with the ipsion points, where it's got to do with the internal organs, and which one might be out of whack, out of harmony, or too much chi, not enough chi. And you palpate around the neck between the sternocleidomastoid muscle through to the trapezius area, scalenes, and just above the clavicle. And these areas are all areas that we use in YNSA to diagnose where the issues are via sensitivity.
So do you find that diagnosis is really important in terms of to achieve the best result for YNSA?
It is important to do the diagnostic tools. A lot of the times it works really well for me to work out what side of the body are we going to be treating, and what organs or what parts of the body are we going to be treating via the scalp.
Mm-hmm.
And this is important. There are times where I felt where clients did not feel the sensitivity in certain points, and sometimes I'll choose the side that is the sick side, and I'll do ipsilateral.
Mm-hmm.
And sometimes if it doesn't work, I'll go contralateral. But a lot of the times when I do utilize the system itself of diagnostic process, it works, and it works well. It's better to use the diagnostics tools rather than just go ipsilateral or contralateral or bilateral.
Mm-hmm.
This is the first step. If you don't find that the client is sensitive with the points and the palpitation, then you can just try ipsilateral. And then if that doesn't work, I go contralateral.
Mm-hmm.
I'll go both ways.
Yeah. All right. Thank you. And do you think that after learning YNSA, it has helped you to grow your patient base or patient numbers, or more confident in treating some of the condition, and that will, turn out with retaining more patients and more referrals for you?
Yeah, well, a lot of the clients that I see when I do use YNSA, sometimes it's standalone, and sometimes I'm utilizing with other systems as well. What's important is that with any system that you do, you put a treatment plan together for that client.
Mm-hmm.
And, you do the best that you possibly can, and that includes doing your diagnostic tools and applying the YNSA method. And some of the issues that I've been dealing with are MS, Parkinson's, neuropathy associated with chemotherapy in the hands, in the feet, and it works fantastic. I can't recommend it enough.
Okay. Cool. All right. Thanks, Jess, for taking time out for joining me today. So we're going to hopefully to get more acupuncturists in Australia and New Zealand to be able to learn this method, so they can help more patients in their clinic and grow their practice.
One of the things that when I finished the course in 2023, I think was it May that we did the course? Or was it February or May?
March or April, right?
Ah, there you go. Could have got that completely wrong, didn't I?
February.
Yeah.
February.
So as soon as I came back, I was putting it into practice, and I had students with me from the university, and the best way to learn is to teach. So as soon as I got back, I was utilizing it, and I was showing my fellow colleagues at the clinic what I had learned.
Mm-hmm.
And by teaching, you also learn. So, to pass on that knowledge is fantastic. And hopefully I've encouraged some of these students from Western Sydney University in the past to come and do the Sustained Health Academies course coming up in May.
Yeah. All right. Thank you. Thank you very much. All right. Any more
Welcome.
to add? No?
Um,
I think we
if
covered everything, right?
I think you wanted me to talk to you about recommending others for acupuncture. No, we've talked about that. I think you wanted me to give you a client of mine and to go
Yes.
through the experience. Yeah,
Yes. So
I think
I'll help us
we
out with
missed
that.
that one.
All right.
Yeah.
I'll just ask you a question. All right. Hi, Jeff. Do you have any particular case or patient that you have a strongest impression that you achieve a significant changes or improvement for the patient with YNSA?
I certainly do. I had a client that had fusion of his cervical spine. And when they were doing the operation, they actually found cancer in his throat. And, he also had radiation and chemotherapy to obviously get rid of the cancer in his throat. But he had a lot of issues afterwards, especially when it came to swallowing. Okay. He had a very, very dry mouth. And he sometimes would regurgitate the food that he was trying to swallow, and it would come out not only his mouth, but his nose as well. So he was only having clear fluids. He was scared to swallow. It was sore to swallow, and it was very dry and tight. So he was living off just water and sustagen, and he was losing a lot of weight. And I said, when he came in to see me, I was like, you gotta get off the sustagen. You need something more than that. You need to have some sort of bone broth, soups, and then later on progress to, maybe mashed up foods, soft foods. And he was scared to swallow, not only because he was in pain when he was swallowing, he was scared that he was going to choke. And so I started doing my treatments on him. And again, I went straight to the palm. I looked at one side to the other and chose the one that one had good color, one side didn't have good color. And the side that didn't have good color was the left side. And the operation we had where the cancer was on the left side too. So strangely enough, it matched up there already before I even did any of the palpation system. Then I went to Hegu on both sides and pressed into Hegu area. And again, left side was predominant. So I stuck to the left side. I went to the cervical area on the elbow. It tested positive. It was sensitive. Then went to the thoracic area, and that was a little bit sensitive as well. In the lumbar area, no, there was nothing. So already, I was going to be going for the A point on the top of the head, which has got to do with the neck, the head area on that left-hand side. So what I got him to do was actually just swallow and drink a little bit of water to see how it felt before I put the needle in. So when I touched that area in the elbow crease where it's got to do with the neck, it was sensitive. Then I went to the head, did the A point, went back and touched the A point. Less sensitive. Great, fantastic. Then I went to the bicep. He was obviously anxious as well to swallow. So he was nervous and stressed out. So I went to the brain points and I saw that the basal ganglion area was really sensitive compared to the cerebellum and the cerebrum. So I did the basal ganglion point at the top of the head. And at that stage, I was pretty new at Yamamoto Scalp Acupuncture. I just finished the course in 2023. And he had throat cancer and it was quite tender right through the whole area. And it was really hard to distinguish where his sternocleidomastoid muscle was. And so I left the neck out at this stage. And I palpated, found the A point, put the needle in. I did the basal ganglia, palpated, put the basal ganglia point in. And then I said, okay, I'm going to just have a look at these cranial nerves. So all I did was palpate through. And between cranial nerve 9 to 12, I found some sensitive points. And if you look between cranial 9 to 12, you're going to see it's got a lot to do with the vagal nerve and a lot of things to do with the throat. Anyway, so I put those in. And then I went back and I said, okay, have a drink of water. and he had a drink of water, and he goes, "Oh, still a little bit sore, but you know what? Not nearly as bad." And he was able to swallow and take it down and not regurgitate the water, which is fantastic. And he noticed the difference, and I was really happy with that. Now, what's really good about Yamamoto scalp acupuncture here is that we're able to check our points are correct, okay, by feeling at the elbow crease, the cervical area, and then putting that needle in and going back there and touching it. It's telling us we got it. Okay, we don't even have to really check to, for the swallow, but it reassures our clients to tell them that, hey, you know what, we just did the right thing because the swallowing was better. He also said the dryness in his throat wasn't as bad. I said, well, is that because you've just been drinking water? And he goes, no, even if I do drink some water and take it down, it still feels really dry. And he didn't feel that the same type of dryness in his throat, which is fantastic. I've seen this gentleman 34 times, okay? 34 times. And, you know, he's had surgeries afterwards where they've expanded his esophagus, you know, increased the diameter slightly and stretched it out. And as soon as that is done, he comes into the clinic and I do a short course of treatment for him to reduce that inflammatory response through his throat so he can start swallowing better, a lot quicker again. So he's moved from liquids to soft foods. It's a process. He notices the difference, which is fantastic. And I know when I'm palpating and doing what I need to do with Yamamoto, it gives me the confidence knowing where I'm pressing and then going and putting the needle in and coming back. And I press into that point. It reassures me as a practitioner I'm doing the right thing by my client. And this is something that the other styles of scalp acupuncture do not provide. And that's why a lot of you guys that are watching this podcast or on Zoom should be doing the Sustained Health Academy's YNSA course that's coming up in May.
Thank you. Thanks, Chef. I think I'm very happy to hear that because with me, organizing all the great teachers like YNSA that from Japan coming to Melbourne, a lot of effort. But even you can help with one case like that, that is like more than enough. You can help a person when the world is
100%.
giving up on the person. Then we, as a Chinese medicine practitioner, acupuncturist, can achieve such a great result for the suffering, then no one can help. I think that being $1 million, like it's just treating one case. I believe there's cases like that, but that's what made Chinese medicine acupuncturist such a great profession, because when the world giving up the patient, we step up, we deliver.
100%.
About 30 session, even 60, 70 session.
Doesn't matter.
You improve the quality of life, that more than $1 million. I think that is why we try to challenge, we acupuncturists can treat all type of suffering and difficult cases that Western medicine, they don't have a great way to improve the quality of life of a patient. Then we actually can step in and do our job. And that's why we keep on learning. We have an academy. We try to challenge this mountain, higher mountain and higher mountain, but we keep on growing. So I really like Jeff, you are the one of the, the student came to academy. They keep on learning. I think that is a great spirit and the attitude to learn acupuncture and Chinese medicine.
100%. There's another thing that I really wanted to emphasize to the students that are going to do Yamamoto scalp acupuncture. We cannot learn this from a book, okay? You need to be with a master, Tetsuharu and Mika have spent the time with Yamamoto Sensei. You get the opportunity in the class to feel how he touches you and the depth and the pressure that he uses. You don't have to press hard to feel for the sensitivity. You cannot learn this from a webinar. You cannot learn this, from a book. The only way you're going to be able to learn this is you going and showing up so you can see directly and feel the pressure the movement, how he palpates, and pay attention to those details. You cannot get that anymore. You're not going to get that through a webinar. You've got to come into the seminar to see that. So this is something that, you know, this is the art, you know, and, you know, Sustained Health Academy is bringing the disciples in direct from the source. So you can't go wrong. So highly recommend the course. You've got to go. I'll be looking at doing the advanced course in the near future. Again, Scott handpicks these disciples. He goes and does these courses himself. So get in there, come and see, because you will get the best out of it. You'll be able to take this home and utilize it at the clinic the next day. There's only 40 odd points out there, and some of these points in Yamamoto don't even fall on the normal channels. But hey, you know, there's only 40 odd points. You know, there's not that many points to learn. You can take these into the clinic and you utilize it straight away.
Okay.
Thanks, Scott.
Thanks, Jeff. Thank you for today. All right.